order. Palmer. I call this meeting to order. This is the Standing Committee of Health. I'm John A. McDonald, the MLA for Hants East and the chair of the committee. Today we were here from the Victorian Order of Nurses, the Department of Seniors and Long-Term Care, the Nova Scotia Nurses Union, and the Canadian Union of Public Employees regarding home care and community care. Reminder, please set your phones to silent. Now I'll ask the committee members to introduce themselves for the record by stating their name and their constituency, starting with MLA Young.
Okay. Good day, everyone. Nolan Young, MLA for Shelburne.
Good afternoon. I'm John White. I'm the MLA for Glace-Bain Dominion.
Good afternoon, everyone. Chris Palmer, MLA for Kings West.
Hello, everyone. Danielle Barkos, MLA for Chester St. Margaret's.
Good morning. I'm Kelly Regan. I'm the MLA for Bedford Basin.
Good morning. Good afternoon and welcome. I'm Rafa Di Costanzo, the MLA for Clayton Park West.
Hi, I'm Gary Burrell. I represent Halifax Shabukto.
Okay. For the purpose of answer, I'll also recognize the presence of Leg Council Philip Gresser and Legislative Committee Clerk Judy Kavanaugh. So today is home care and community care. I'd like to welcome all the witnesses, and I'm going to ask them to introduce themselves, and then we'll start with opening remarks. So I'll do introductions first, and then what we'll do is opening remarks will go left to right, closing will go right to left. So I'll let Jeff Densmore introduce himself.
Good afternoon. Jeff Densmore, Regional Executive Director for VON in Central and Western Zones.
Hi, I'm Carol Curley. I'm a Regional Executive Director with VON, and I'm for North and Eastern Zones.
Good afternoon. Tracy Barbrick. I'm the Deputy Minister of Department of Seniors and Long-Term Care.
Good morning. I'm Janet Hazelton. I'm the President of the Nova Scotia Nurses Union, and we represent all the licensed staff, which would be the RNs and the LPNs that work for VON.
Good afternoon. I'm Nan McFadgen. I'm the President of CUPE Nova Scotia.
Okay, and for opening statements, is it Mr. Densmore or Ms. Curley? Mr. Densmore.
Thank you, and thank you for inviting Carol and me to appear before the committee. VON is a national not-for-profit home and community care agency accredited with exemplary standing. We've been providing home care to Nova Scotians for over 125 years through nursing, home support, and a variety of community support services. Today, VON in Nova Scotia operates out of more than 12 locations across all 4 health zones. In the past year, 2,000 plus staff and volunteers delivered over 2 million home and community visits and over 300,000 meals. We work collaboratively with government to look at new ways to continue to support Nova Scotians who wish to remain in their homes and in their communities. We have strong partnerships with our unions, NSNU, CUPE, and NSGEU, Workers' Compensation Board, AWARE-NS, and Nova Scotia Health. We are well represented at health sector tables such as HANDS, Home Care Network, Continuing Care Council, and the Provincial Nursing Network. Like the rest of the health sector, the HHR crisis is our most significant challenge. However, we remain committed to safe, quality care and take pride in being a well-respected leader for home and community care in Nova Scotia. Thanks for having us, and look forward to the conversation.
Thank you. Nothing for Ms. Kerr? Okay. Deputy Minister Barbrick.
Good afternoon. Thank you for the invitation to be here today. I'm grateful for the opportunity to share with you some of the work that's underway within the Department of Seniors and Long-Term Care. I have a few staff with me today. Janet Lynn Huntington is the Senior Executive Director of Continuing Care. Kim Silver is the Director of Home and Community Care. And Michelle McDonald is a project executive that's also an RN by training. I'm also pleased to be joined by our partners from NSNU and CUPE Nova Scotia and VON Canada. I want to acknowledge and thank Janet, Nan, Jeff, and Carol for their continued advocacy in the continuing care system and the many suggestions that they have brought forward to improve the system for Nova Scotians receiving this care and the people who work in it. The solutions to address and meet the care needs of an aging population will not be found in an old way of thinking. It takes innovation and collaboration, and it takes focused attention, which is precisely why government has established the first ever dedicated provincial department in Canada solely focused on the needs of seniors. Our department is working to hire and train more continuing care staff to support and take care of the dedicated people that are already working in the sector, to create pathways for people to advance their skills, to provide Nova Scotians with the care and support they need in their homes and communities, to build more long-term care homes, and to improve the quality of care for Nova Scotians who need continuing care. Our goal is not only to stabilize the continuing care system. We want to position Nova Scotia as a leader in delivering the highest levels of care in the country and be a leader in age-friendly communities. A great deal of our focus and the focus of today's conversation is about supporting people in their community as they age. We know Nova Scotians want to stay in their home for as long as they can, but often they need specific support to help them do that. We are funding innovative projects to provide even more help in this area, exploring new models for home care delivery, day programs, and supportive equipment. We know that participating in social and physical activity plays an important role in how fit or frail a person will become later in their life and their ability to take care of themselves as they age. We're addressing this through programs like the Age-Friendly Community Grants, which provide grants for community-wide effort to create and promote healthy aging. We're also expanding the Centres of Rural Aging and Health with 2 newly opened centres in Nova Scotia's Community College Shelburne and Port Hawkesbury campuses for anyone over 55. These centres offer programs and workshops that benefit social connection, health, and well-being of seniors in communities. And we're testing new programs like Capable, where teams will support seniors in community through education, small housing upgrades, and modifications to support safety and independence. We're supporting innovative methods to deliver care, including nursing clinics, cluster care, virtual care, and the list goes on. And we're also investing more into direct funding to provide flexible home care supports for families to access additional options to support their loved ones at home. While we know there is more work to do, these investments are making a positive impact. We will continue to work alongside of our partners to test and deliver programs that provide Nova Scotian seniors with the services and supports they need. I look forward to our discussion today. Thank you.
Thank you. Ms. Hazelton?
Thank you. Good afternoon, everyone. Thanking the Standing Committee for the interest in community care. It's a very, very important part of our health care and doesn't often get the recognition that it deserves. The Nurses Union, we represent 8,000 nurses in this province, including NPs, RNs, and LPNs, 1,000 of which work for VON currently. Today, our focus is on community care nursing, a cornerstone of healthcare delivery that reaches into the very heart of our communities. Community care nurses, often the unsung heroes of our healthcare system. They provide essential care in the homes of our fellow Nova Scotians. Their commitment to their patients is unwavering, but their voices and concerns are sometimes drowned out by the demands and the vital work of our acute care system. It is my duty today to bring their voices forward to those best positions to influence law and policy in our province. Through a recent survey of our community care nurses in preparation for bargaining, we uncovered several critical themes that demand our attention, 3 of which I'll highlight for you. Workload and work-life balance. Nurses in community care frequently express concerns about their workload. Many bear heavy caseloads and find themselves working overtime regularly. Achieving a better work-life balance is a shared aspiration, with requests for more predictable hours, reduced evening shifts, safer working conditions, especially during late hours. Full-time nurses that work more hours and more on-call shifts rated their work-life satisfaction significantly lower than both part-time nurses and nurses who do not take call. Staffing and scheduling. Issues related to staffing levels, scheduling, and the use of on-call shifts are prevalent in the comments we received. Nurses seek better and more predictable scheduling practices, self or team scheduling, and more equitable distribution of work, particularly regarding on-call and overtime. The interference between continuing care and our community nurses. The interference between continuing care and community care can sometimes be problematic, creating barriers to nurses using their professional judgment. A nurse may want to return to a client's home because they need to monitor something. Could be a catheter that they saw blood in, etc. However, this usually requires clearance from the continuing care, which, as a result, gets unnecessary delays. Nurses need more autonomy in their practice so they can exercise their professional judgment. Furthermore, continuing care seems to be under-resourced with intake assessments completed over the phone instead of in person. This means VON nurses are filling in the gaps on their first visit and sometimes lack vital information about the situation they are walking into. One of the most significant problems with community nursing and others that go into the home is safety and support. Safety concerns loom large for our community care nurses, particularly when working alone in a potentially risky situations during evenings and night shifts. The home environment is often unpredictable, and nurses have very little control over enforcing rules around hazards like smoking, pets, firearms. Family members who may be in the home are sometimes unknown to the nurse. Also presents a layer of unpredictability and added risk. When even cell coverage can be sporadic, we all know that cell coverage can be sporadic in areas of our province. Nurses feel especially isolated and very vulnerable. Nurses desire more support, access to resources, and improved communications between themselves and the continuing care coordinators regarding their safety concerns and protocols. In closing, I would like to express our sincere commitment to working collaboratively with all stakeholders to address these concerns and to ensure that our community care nurses can continue to provide exceptional care to Nova Scotians. I'm here today to facilitate any dialogue and welcome any questions or discussions from the committee members to further explore these critical matters. Thank you for your attention, and I look forward to our conversation.
Thank you. Nan McFadden.
Thank you. So we represent approximately 22,000 members in Nova Scotia, and you'll find us in all sectors that are predominantly public, municipal, provincial, and federal. I want to thank the committee for looking into the question of home care and community care today. I bring you a very simple message. The conditions of work are the conditions of care for the clients we serve, and right now the conditions of work and home support are in a staffing crisis. Why do I say conditions of staffing are in a crisis? Well, one telling fact is that if you had asked me last year how many people we represented, I would have told you 500. This year, I will tell you 450, because we've lost 10%, and the agencies have not been able to recruit replacements for these workers. These challenges directly affect, the challenges that we will be discussing directly affect recruitment and retention of workers in the sector. Without the workers, it's impossible to provide the home support and community services. Home support workers must have a personal vehicle in good condition to work in the sector. This is not a cost that other healthcare workers would have, and it acts as a barrier to the profession. Running a personal vehicle is expensive, and if there's a breakdown, it's all out of their own pocket. If you work, for example, in a hospital or a long-term care facility, you can take the bus, you can be dropped off at work. And if your car breaks down, what is expected from you if you're a home support worker? You're required to have a second car or pay for a cab to go from place to place, all out of pocket. Yes, our members have negotiated mileage and a car allowance, but it's not enough. For example, car allowance at one agency is $15.24 a day, or $334 a month, and that is nowhere near what it costs to buy, insure, gas, maintain, or repair a vehicle. That amount won't even buy snow tires. Our home care and community care system literally drives on a subsidy put into the tank by low-paid, overwhelmingly female workforce. This is shameful and can be fixed easily by government increasing the amount funded for a car allowance. It's hard to sell and recruit a person to the home care sector. This is the case even if they have a personal vehicle and are willing to put it to use, and even if they're willing to absorb the higher gas prices every time gas goes up, all for the greater good of Nova Scotian seniors and other vulnerable clients. But recruitment to the sector gets even harder when the same worker is told they cannot have a regular schedule, or even know that they will receive guaranteed full-time or part-time hours. A representation of a conversation that goes with a candidate employee. The employer, come work for us in home care. The employee, well, how many hours will I get? Oh, between 20 to 40. It depends. But you need to be available for 40 hours in case we want to call you. The employee, no, thank you. I ask each of you around this table, would you sign up for that deal? At the same time, you could go down the road to a hospital or a long-term care facility and get a job with guaranteed hours, a pension, and not need to run your personal vehicle into the ground. This is a shameful situation, one that this government can easily fix by fully funding full and part-time hours to agencies to guarantee hours. At present, the government only funds agencies for contact hours with clients. Why do we do it this way? Well, government saves money by not paying home support workers if there is any downtime in the schedule where a client is not being visited. Of course, what this means in practice is that home support workers are paying for the system's flexibility through a reduced paycheck and a working life in poverty. What makes the situation even more maddening is that government saves 5 times the cost of a long-term care bed and 20 times the cost of a hospital bed. Every day, the client remains at home with home support. You might think that it would make sense to build the best system possible by taking some of those savings and reinvesting them into home care and community care system that had excellent working conditions and care conditions. But government declines to take this path. After our union has made this point repeatedly over the years to different governments and different ministers, it is difficult to come to any other conclusion than the government is happy with a majority female low-paid workforce subsidizing the flexibility of home care and community care within our province. They do that when some weeks they go with 32 hours of pay, some weeks 27, some weeks when they're lucky they get 40. I ask you, does your paycheck vary from week to week? What stress would that cause in your life, especially if your car broke down and you needed it for work? Regardless of whether you support unionized workers or not, if you support high-quality home care and support basic human decency, the funding formula must change. We know that good pay and benefits attract workers. This is just not CUPE Nova Scotia making radical statements. You would get the same recommendation from Morneau Chappelle if you paid them $100,000 for a consulting study and asked them how to recruit workers to home support. So how would we fix this situation where workers who take care of the elderly and vulnerable get paid poorly? The solution is not all that complicated. The government could decide to have regular working hours, to fund regular working hours. It should not be a surprise to anyone that there is a crisis in home care and community care. My message today from home support workers has been that the crisis has been one of government's own making, and at the root of the crisis are the poor working conditions in the sector right now.
Nah, just a question.
Sorry.
This is to me. So you're at 6 minutes, so I'm just wondering how much longer, because everybody would have been told like to be a little over 3.
Sorry.
So,
well, I'm at the conclusion, so.
Okay, sorry,
Okay.
finish up, thank you.
I apologize for that. There's a lot to be fixed. So let me just go to, I'm usually the shortest one. Right?
You're taking Jeff's time.
Yeah, I am. I do apologize for that.
No, that's.
So now I lost where I am. Okay. So do we continue with a system that relies on this critical public service being delivered by the workers subsidizing their clients' visits out of their own pockets? We want for every Nova Scotian to have access to home care and to retire in dignity in their own home. Because we have built a system which is predicated on overwhelmingly female workforce with irregular and non-guaranteed hours, and a group of workers who will never be able to afford their own home at the present rate, do you know of a bank who offers mortgages to people that can't say for sure how many hours they work? Because I know a few support workers who could use that. Regardless of whether you're supporting a unionized workers or not, support human decency and do the right thing. Agree that home support workers and that this unjust situation must be fixed, and it must be fixed immediately.
Thank you. Okay, so just to remind everybody how the mics work, I'll recognize you and your mic will go on, and don't feel bad, we mess it up too. Each caucus gets 20 minutes each to speak, so at the end of 20 minutes, if you're speaking, I'll say order. It's not to be rude, it's to make sure we have enough time. At the end, then I'll divvy up the 3. We'll wrap up at about 2:40, and it'll be to the Liberals, so MLA Regan.
Thank you very much for your opening statements and for coming out today. Can you hear me okay with the mask on? Okay, we have a new little family member, so just taking care. We heard a lot there, particularly from our last two speakers. Ms. Hazelton, what are the staffing shortages like in the public home care sector for your particular union? If you can answer that, you may not be able to, in which case we'll go to the VON. And do you have vacancies in your union as well for home care too? So if you could answer those, okay.
Yeah.
Ms. Hazelton?
Yeah, oh, sorry.
No worries. We'll do it too, don't worry.
Yeah, no, there are vacancies in the whole system, and VON is not immune to that. So yes, we have both RN and LPN vacancies. One of the things I didn't mention that I think would be important is I believe VON should be funded to hire nurse practitioners. I think that would be very helpful for nurses because you have to have a primary caregiver to access the program. And if you have it and you access the program and you go in the hospital and then you have to access the program again, if in the meantime you lost your family care practitioner, then you can't get back into VON. So I think it'd be really good to hire nurse practitioners for VON that work for VON so that nurses can troubleshoot on the road. They can call the nurse practitioner and say, you know, my client looks like they have a UTI, and then they can be instructed to do whatever they need to do in order to make sure that that client doesn't have to leave the home and go to our emerge department with a UTI. But we have shortages, but that's across the system. I wouldn't say it's any worse for VON or long-term care, but it's certainly a problem.
So you want VON to answer? So
They have the numbers.
Mr. Densmore, Mrs. Curley, which Mr. Densmore?
Yeah, so if we look provincially at the RN level, we have a deficit of 26 RNs in the province, and at the LPN level, it is 58.
MLA Regan.
So, Ms. Hazelton, we've spoken about safety and nursing before. If I were to say, what are the top 3 things we could do to ensure the safety of nurses in this particular sector, what would those be?
Ms. Hazelton.
Making sure that there's a proper home assessment done before the staff go in, and that is the responsibility of continuing care. Years ago, they actually physically went in and did it. Well, now they don't. They do it over the phone. So that's a problem. I know funding is an issue, but even if the first visit could be 2 people, it doesn't have to be 2 nurses. It needs to be a nurse and someone else. Maybe the care person that's going to be working with that client, because you're always safer if there's 2 of you. Going into someone's home by yourself, I don't know how they do it because I don't know if I would. You know, you don't know, there's dogs and, you know, if you're afraid of dogs, they're told to put their dogs and cats away, but they don't often, or they do it the first time, and then they don't do it after that. There's firearms in the house. Sometimes there's neighbors that might be there, or there's family members that may or may not be stable that are in the home. All of that's not accounted for. So, you know, in an ideal world, I would have 2 people visiting. Maybe someone doing the care and someone doing something else, but we don't allow people to work alone in acute care, ever. But yet they have access to hundreds of people with a phone call. These nurses do not. And they go out at 11 o'clock at night. I just can't imagine going out into someone's home at 11 o'clock at night to do an on-call visit. Like, it's dark. Sometimes you're going Barrington Passage where there's no cell coverage. It's not, I don't know why we have the 1,000 nurses we have, honestly, because I'd be terrified to take some of those personal risks.
MLA Regan.
So you mentioned cell coverage. Would that be number 3, that you would like to ensure that we have cell coverage through the entire province?
Ms. Hazelton.
I just spoke to VON recently about BC have some sort of a tag of some sort that they have on all their community care workers, so they can always find out where they're at. Where if they have spotty coverage, I could go out at 9 o'clock at night, and if I'm somewhere there's no cell coverage and I don't come back, like, they don't even know where I'm at. So, yeah, cell coverage is really important.
MLA Regan.
Thank you very much. Okay. In terms of wait lists, what's the current wait list for VON or community nurse services? Is there a wait list?
I'm guessing that is to VON. Ms. Curley, sorry.
Yep. For nursing services, there isn't a wait list. If we have a capacity on any given day, there might be a delay in providing services on that day, but that's usually just very short term, and it gets corrected within as quick a period of time as we can. On our home support side of things, with our CCAs and our home support workers, there is a wait list across the province. Yep. And the wait list right now, I'm looking for my total number. We're just shy of 5,000 hours across the province.
MLA Regan.
Okay, so we know the government's been trying to recruit more CCAs and other healthcare workers internationally, and we had heard in January there were 50 new healthcare workers coming from Kenya that were going to join us, but when we last checked, they weren't actually working yet. Do we know what the situation is there? And I'm not even sure where to address that. So it could be Deputy Barber.
Who wants to raise their hand? Oh, Deputy Barber.
Thank you for the question. We do have some of our early recruits from those international recruitment trips have now arrived in the province just recently. So people are in the process of getting settled in their community with their employer and oriented to the position. So I think we had 3 people from the Kenyan refugee camp just arrive a couple of weeks ago. So early days, so the first year and a half of those international trips have really been about creating pipelines with communities and recruiters and the country that has its own rules in place around exporting talent and sort of building that pipeline, and then we expect to see in the upcoming years that will start to pay off. So early days, we do have a few people here now.
Oh, Ms. Hazelton.
I do want to emphasize, though, that it's going to be a challenge to have these nurses working in the communities. Like, it's a challenge to get them in acute care with the orientation that's required. There's a significant amount of orientation going on now. We have a couple of hundred nurses from the Philippines that are in the system, and they're getting significant orientation, which is just not possible in the community. Like, I don't, and often they wouldn't have a vehicle when they arrive. So I think specifically for community, and VON can correct me if I'm wrong, they just recently started hiring new nurses. Before, years ago, when we had lots of nurses, you had to have 5 years experience before you worked in the community, because you're on your own doing these assessments. And so you have to know. You can't call another nurse to come say, will you come and look at this to see if I'm on the right track? That doesn't happen in community. So I think attracting internationally educated nurses to the community is going to be a huge problem.
And I'm taking from what we just...
MLA Regan.
Sorry.
No problem.
See, I did it.
I know you do it.
And I'm a committee chair, right?
I do it at PAC, so.
And I'm assuming that when the deputy says, you know, we have 3 who are here now, they're not working yet. They're not working as nurses yet, is that correct?
Deputy Minister Barber.
I just want to draw a couple of distinctions on that. So the province has done several international recruitment trips, about 6. There's lots of employers that are doing independent international recruitment that's outside of that. So certainly VON is very active in this space. That you, if you're comfortable with that, they might have some additions.
Emily Regan.
Thank you for that. I think that during the summer, I think it was in August, we heard that 16,000 new nurses had been registered from the Nurses College. And I sent several FOI pops asking how many are actually working. And I was told, we don't have that information. Does anybody here have any information on the 16,000 new nurses that were registered? How many are actually working?
Deputy Minister Barwick.
That program was overseen and managed by Department of Health and Wellness. So while continuing care might be a recipient of some of those recruits, we didn't actually manage the program. So I don't have the current data on that.
Okay. MLA Regan.
Thanks. We'll go back to them for the third time. Okay. I think I need to pass this over to my colleague, even though I have way more questions, especially for Ms. McFadgen. But over
Let's
to.
see how I do. MLA D. Costanzo with 9 minutes.
Thank you very much. I'm going to ask questions in regards to the patients. If I could ask maybe Deputy Barbrick, how is the private home care sector monitoring the department how is the department monitoring the safety and regulatory compliance to keep patients safe? My question is, what I'm hearing from the community and from my constituents is that they're allowed 12 hours a week for home care, and they barely get maybe 7 to 8 hours because there's always cancellation last minute, a huge number of cancellation, especially the weekend. So home care is not showing up in the weekend. Home care is, again, always somebody new, and this constituent was telling me that she spends half of her 3-hour respite or 4-hour respite in training them for half hour to 45 minutes. So who's monitoring, and the private sector who's sending those people?
Deputy Minister Barwick.
Yeah, thanks for the question. So we have 18 agencies that are in contract with the provincial government. So when it comes to those 18 agencies, we are in regular engagement with all of the providers. There's an annual report due. There's a contract in place. We monitor cancellation rates across the province and manage kind of fiscal management, number of hours of care delivered. And through our work with WCB and AWARE Nova Scotia, there's active monitoring around some of the safety issues. There's absolutely no doubt that this is an area of work that is extremely challenging and extremely valuable. And all the things that Ms. Hazelton has raised around the differences between facility-based care and home-based care are 100% accurate. There have been a lot of investments in the last couple of years in safety, and I can talk about that more later. But we are in very close contact with all of the 18 providers. Certainly VON could provide more on that if you want to talk with them.
D. Costanzo.
Thank you. It wasn't the VON. Most of VON I hear are very well experienced, and they're not getting but more of the CCAs or the I call them PSWs because I have parents in Toronto, and we use that. And I found that in the city here, Halifax is small. So, the distance that they travel isn't that big of a deal, but in Ontario it is. And when you have CCAs or PSWs that are traveling only 1 or 2 kilometers, you can keep them. So we have a PSW that's been with us for 6 years for my parents, because the St. Elizabeth in Halton only allows them to travel certain distance, and that helps a hugely for the CCAs to be able to afford and to get there on time and to do things. Have we tried something similar here so that we limit, the distance where they can travel, so they're not paying as Ms. Nan has mentioned, how difficult it is for them to pay for travel, for this, and they've tried it in Halton, and the same PSW has been with us for 6 years, looking after my parents in Ontario. Do we have something like that here?
I assume that's to the Deputy Minister.
Correct.
Deputy Minister Barwick.
Sure, thanks. I just want to make sure that I'm kind of tracking that question accurately. So let me take a crack at it, and if I miss it, come back at me. So we have 18 agencies. They are geographic in basis when it comes to home support. So the nursing capacity delivered in the province is either by VON or Nova Scotia Health. So there's really only two providers of nursing. So VON is divided, and I don't mean to speak for you folks, is divided geographically across the province, so their workers are based in certain geographies. So that's the same with the 18 home support. They cover a particular geographic area. So the workforce turnover that you're referencing and having the same employee kind of attached to your family over a number of years is certainly one of the things that the investments that we've made over the last couple of years is to try to stabilize. So the CCA wage increase on the CCA side, the negotiations that have recently happened with the nurses union are really trying to stabilize and increase wages to keep stability. The other piece is the recruitment. So that continuous ongoing recruitment, and we're starting to see some positive signals. It's early days because that investment was significantly needed, but we are seeing we've got about 10% vacancy rate right now in the sector. It varies, of course, by employer and based on geography, but as a provincial whole, we've got about a 10% vacancy rate. And what that means is every organization is doing its level best to deliver the care that's needed in that geographic area. The addition of the direct benefits that was created 3 years ago now, where we augment and support families to have the care that they need in their home, is where we basically determine the amount of care. It's for the lower levels of care, often housekeeping, some of those things that people can buy in community. So it's not drawing on the 18 agencies. It's a separate kind of consumer-based arrangement that people have made. So all of those efforts are to try to both stabilize the sector as well as ensure that there's capacity there to provide the care that people need.
Emily de Costanzo with 3 minutes left.
3 minutes? Okay, I'm going to move to a different question just because I'm also concerned for as immigration increases and what are we doing to offer, people like my in-laws who only, as you get dementia, you revert to your language. And 90% of the problems is they can't communicate. That is happening in the long-term care, that's happening in home care, and every visit from home care, it required either my husband or his sister to show up to explain. So what are we doing when we're expecting double or the immigration of how are you going to service those people for, especially in the languages that most populated here? How are you looking at ways to service the immigrant population in home care and in long-term care?
Deputy Minister Barwick.
Thanks. I'll take a start at that. And then I know that VON has been doing a tremendous amount of work in immigration efforts as well as kind of orientation. So I know you guys will have a lot to offer there if the timing is right. But part of international recruitment that's a benefit to us is that our immigration pathways into the province also are reflecting different cultures. So the more we recruit internationally, the more we will be ready to kind of serve the population that we hold here in the province. So that's one of the things. The other piece with international recruitment is the onboarding process that the employers are engaging in is a longer path than it probably has traditionally been to ensure that people are properly oriented as they come on the job. But that definitely will be something that will need continuous attention in the upcoming years, as long as we desperately need that immigration pathway both to support the workforce as well as the population of the province.
Does VON want to take a stab with like 40 seconds left, or Mrs. Curley?
Sure. We started our recruitment, international recruitment, just prior to the pandemic, and we've been successful at bringing about 100 internationally educated nurses who are working as home support workers in the problem. They're not working as nurses right now. We certainly, that started our learning journey on what we needed to do to better understand the cultural differences of our workforce, as well as our population that we're serving. So it is very early for us, but it is definitely way up there on the priority to better understand the diversity of both our population and our employees, and if we have opportunity to match, and if we can match with languages
Order.
or match with, yep.
Sorry. 20 minutes for Liberal. MLA Burrell.
I wanted to go back, Ms. McFadden, to the point you were making about how the numbers of your members in this work have declined so much in a year, that you related this to working conditions. One of the things you talked about was the impact of unpredictable hours, non-guaranteed hours. Could you explain a little more about this? Maybe take us through what a working week would look like for a home care CCA, and how it's impacted by the unpredictability of time?
So, Mrs. McFadden or Nan McFadden, which would you prefer? I should have asked you that. Nan.
I guess further to MLA de Costanza's point about living in a city, Nova Scotia, in fact, is very much like Ontario in the rural areas. I live in a rural area, and so we have, in the preparation for coming here, conversations were had with home support workers, because it's their voice that I speak with. And then we have a member from Glace Bay who was a home support worker, who very much, a lot of our home support workers are drawn to the work due to passion. Some, their passion is for long-term care, some their passion is for acute care. So usually home support workers are predominantly there because of the passion that they have for providing work in that kind of setting. That's where they want to be. So a conversation with a home support worker in Glace Bay, who in fact it was costing them money to work, because they live in Glace Bay, and they were finding themselves in places like Manitou and Louisbourg. And so if you live in Glace Bay, perhaps geographically that's not really a connection for you, but it's a jaunt. I mean, I'm from Glace Bay. It's a jaunt from Glace Bay to Louisbourg and back for a different appointment that might be in Sydney, or might be in Glace Bay, or might be in Waterford. So the short answer to Deputy Minister, no, is it Deputy Minister? Yeah. Tracy, is that they're in fact not adjusting for geography, because if they were, we would see less loss. And so in between those calls is dead time. So you're either sitting on the side of the road in your car, and it's winter. We do winter in Nova Scotia, so it's chilly. So you're in your car with it running, so you're not chilly, or you're finding a Tim Hortons, because there's no sense to go back home. And all of those hours, they're not paid hours. And there is not a bank in Nova Scotia that will give you a mortgage if you say, well, I'll work between 20 and 40. And they're like, but how many hours you work? Well, between 20 and 40. But how many of those do you regularly get paid? Well, I don't have a regular pay. So banks are like, stay away from me. And it's hard to get a loan for a car, right? So it's a difficult situation for the workforce, which is made obvious by the previous speaker when they said they have 5,000-hour deficit for home support with continuing care assistance. 5,000 hours. So when you're talking safety of clients, those clients that are waiting, who's actually doing that care while they wait? Some of them are fortunate enough to have family, and some of them are going without. That's exactly what's happening. So yeah, we're in big trouble in home support. Government could fix that. We need the will and the desire to pay people a regular wage.
MLA Burrell.
Thank you. And the other key instance of this you were talking about was the business of needing to run your own vehicle. So could you speak in a little more detail about how this actually practically, financially affects the bottom line of a home care worker?
Well,
Nan? No problem.
It affected it a lot less when gas was like 48 cents a liter. So gas, when I came here, I thought somebody's going to ask about that. Gas, as I was passing the gas stations, $1.59 a liter. So the math doesn't work. In fact, it just doesn't. If you are in fact in a city, you may fare a little better in the city because your distances are shorter to go. But anybody that's in rural Nova Scotia, and let's face it, HRM is huge. From one end of HRM to the other is huge. So perhaps I'm being unfair saying rural Nova Scotia only, because HRM is a huge district. When you're paying for gas, and well, I had to wait in traffic to get here. I don't know about all you. So that costs money to sit and idle in traffic. So members really struggle to make ends meet when you talk about paying for gas. And like one snow tire is $100. One tire. Like, it's the price of things is astronomical. And when you get your wage, which I would agree government has increased, but then there's all these other costs attached to your work, and all of that is just like, well, good luck to you. It's really not working.
Emily Burrow.
Well, thank you. So you spoke about speaking with members about the things that they would identify as central problems. So, what are some of the things that people doing this work are really putting at the top of the list, saying these are the things that we need to bargain for. These are the things we've got to get in order to be able to continue with this.
Nan?
Well, they want to see a better paycheck. So that sounds good. We've increased your wages. But if you're only getting 20 hours a week, then you're going to need to increase them again by the same to make a 40-hour week, right? So if I make, for example, $25 an hour, but I'm only getting 20 hours, I guess I'm like working at McDonald's for the rest of the time. I don't know. Like, I just don't know. There's no other answer except for giving regular, dependable hours. Then you have regular, dependable, continuing care assistance. Why would I come out of long-term care. I'm a nurse in long-term care. Why would I leave long-term care where I can get full-time work and go to home support where I can get what's called full-time work but is really sometimes 20 hours, sometimes 32. Like, I don't know a landlord in the province who's going to say, what, you only got 25 hours this week? It's okay. Just give me half the rent, we're good. Because that's not how the real world works. We need people to have regular, dependable income, and they don't in home support. And until they have that, you're going to have 5,000 deficit hours.
Emily Burrow.
Thanks. And you've spoken about how there have been improvements in wages, but I think we all know home care workers who are working for under the living wage. And so could you say a little bit about what the impact of this is on the sector as a whole?
Nan?
Well, if we're talking perfect world, and I'm pretty sure we're not in that, home support would be a public service. It wouldn't be doled out to 18 different agencies across the province. Home support would be a public service, which would put the same value on it that we put on acute care. And long-term care, while we're at it, would also be a public service. So government's paying for it anyway. You're just paying more because it's private. I get it, that's your jam. But public services are more economically feasible to the taxpayer who are, funding it, footing the bill for all of it. So in a perfect world, home support would be a public service, and then we would be able to provide it in a way that public services should be provided, which would mean meaningful hours of work and a more standardized process across the province. Yeah.
Emily Burrows with 11 minutes left.
Great. Thank you. I wanted to ask Ms. Barwick about that recommendation that came from the Auditor General about maintaining an integrated record of home support complaints, and I think about the disposition of complaints. Has that outstanding recommendation been answered, dealt with at this stage of the game?
Deputy Minister Barwick.
Thank you. Yes, it has. There is a common complaint intake tracking system. NSH, through the 1-800 continuing care line, tracks complaints. We meet regularly as a staff with NSH around that complaint database, themes, trends, things we need to follow up with our service providers. So that has been in place probably for about 18 months. I do want to flag, because it's relevant for a number of things, you know, we could spend the whole day and night here in this conversation. So Alaya Care is the digital system that about half of our care providers are now using. So what that module does, or what that digital platform does, is has several different modules. One of the modules is staff scheduling, so we agree that in many cases we're using an outdated method of scheduling, which is not a benefit to the employees or the clients. So as we move into kind of digital space, Alaya Care is the platform that is kind of used in home care with success, with about half of our agencies right now that are onboarding. I think VON has it in their future, so they might talk about that. So that's one module. Another is family communications. And employee communications. So if I go into a home and the previous nurse that had been there makes notes on the record, then the next nurse that comes in would see that on their iPad with their information provided. So that's the future. It's time to go there. In long-term care, that's Inter-I is a very similar tool. In home care, that's Alaya Care. So we have migrated now half of our service providers onto that platform, and the rest need to come on. That's starts to find some efficiencies in there. So it's just, we're in a digital world now. It's time for much safer for nurses to be able to look at who was there last, or for the home support worker to be able to see what was there last, and starts to gain some efficiency. So there's several different modules in that tool. But it's absolutely the piece that we need to continue to roll out. It's a big change for somebody, a home support agency in Yarmouth or in Inverness that maybe hasn't used that kind of tool before. So we're onboarding folks slowly so that they have time to get it to be part of their regular business, but it's a much more efficient way and addresses some of the concerns that have been flagged.
MLA Burrows with 7.5 minutes left.
Thanks. The point of the Auditor General seemed to me to be looking at quality control in this sector, and some indication that there was an inadequate system about this in terms of responding to things from the public. And in our caucus, some time ago now, maybe a year or so, we made a Freedom of Information application just to find out what the total number of complaints, and the number, like going back over 5 or 6 years, was like a couple dozen, which suggested to me that probably people were not aware of to whom they ought to be in contact if they had concerns. Is that a fair concern, and is it being addressed?
Deputy Minister Barwick.
Thanks. So every person that of the 35,000 Nova Scotians that we have receiving some level of home care, every person has an assigned continuing care coordinator. It's the person that sort of supports the intake as well as their primary contact about changing needs or escalating our requirements, and kind of conflict resolution. So there's lots of discussions that would happen at the individual case management with that care coordinator helping to resolve any issues either in the home or with the agency, conversations with the agency about what level of care and whether the care needs are being met. That is separate from something that really would be kind of a formal complaint. This cannot be resolved. We have a quality concern. It's gone beyond that continuing care coordinator. So it's possible, I don't know what numbers you might have seen, but it's possible that those numbers look low because there's so much general resolution that happens at that between the care provider and their continuing care coordinator and the person themselves. So it could be that those issues you wouldn't see reflected. It's things that are escalated past that and can't be resolved.
MLA Burrows with a little over 5 minutes.
Thanks. But it is not the case at the moment, is it, that there is publicly available information about complaints received, the type of complaint, the category, and the general resolution? We can't, members of the public can't access in the home care world that kind of information now, can they?
Deputy Minister Barbrick.
Sorry. Meaning a phone number, a call number to call, or do you mean a record of those complaints and concerns? No, there's not a public report issued on that. We do in long-term care, there's the Protection of Persons in Care Act. So if there's a complaint filed, it's investigated, it's deemed to be founded, there's corrective action issued, instruction to the provider. There's a report that's issued on that right now, monthly, quarterly.
MLA Burrow.
Well, I guess that's my question. Why would we find it helpful, from the point of view of quality control and care, to have that in long-term care, but not have that information available about the world of home care? And isn't this what the Auditor General was talking about?
Deputy Minister Barbrick.
No, the Auditor General's comment wasn't related to a public processor report. It was generally there should be a complaint line where people can call and log a complaint. So that exists right now. The public report has not existed. There's legislation around the Protection of Persons in Care Act and some pieces in place to make that mandatory. And so far, the home care kind of world conflicts have been resolved generally with the care coordinator.
MLA Burrow with about 2.5 minutes.
Do you have a general sense in the department of the number of complaints that would have been received, say, in the last year?
Deputy Minister Barbrick.
Dozens, hundreds, handful?
Yeah, no, it wouldn't be hundreds. So Kim Silver, that I introduced you to earlier today, she's the Director of Home and Community Care. She meets regularly, and her team meet regularly with the care providers. If there's themes or concerns that have been identified in their annual report or their quarterly kind of service delivery, then they address those through those meetings with the care providers. So no, I mean the canceled visit thing that a few of you have raised, that's absolutely something that we're improving. So we have right now, while we hear a lot about canceled visits, and it absolutely is legitimate, a much larger portion of canceled visits come from the client. So it's about 90% of canceled visits come from the client. So one of the pieces that we're mindful of is that the client is aware of the implications when they kind of cancel appointments. So the canceled visits that are from the provider are about 10% of the time, but we do have work to do to make sure that everybody understands the implications of those canceled visits for sure.
MLA Burrow, 2 minutes.
I want to just ask you quickly about, with home care, income eligibility. Do you have a general sense of the last time this was updated? I mean, in the present inflationary situation, it's a big consideration.
Deputy Minister Barbrick. I just demoted you almost.
No, I don't want your guys' jobs. So those are updated regularly. That was last updated maybe about a year ago. And interesting to note, and that's online, you can find that income table if you, I'm sure you've looked at it, but about 75% of our home care clients actually don't pay anything because they're below the income eligibility. And that's one of the things that we're monitoring with inflation and the other aspects that influence a person's household income.
MLA Burrows with just over a minute.
So in the department, is there any thought being given to indexing the thresholds?
Deputy Minister Barbrick.
So we would have seen, and I think you've talked about recently, the Seniors Care Grant we increased about $250 this year. It's not necessarily pinned to CPI, but definitely an increase recognizing the changing costs. The other thing I would draw attention to, lots of things outside of my wheelhouse, but I think one of the pieces that people don't fully recognize is the income tax rebate for seniors over 65 in the province. So there was about $17 million returned this year that's reflective of the provincial income tax collected for anybody that is GIS eligible, is also eligible for that rebate. Can be up to $10,000 a year, but it's directly remitted to the client. They don't apply for it. So that's one of the pieces that I think isn't well understood about a provision for seniors in this province that's a benefit.
MLA Burrows with like 3 seconds.
Thank you very much. Thank you.
Okay. MLA Barkhouse.
Thank you, Chair. So I have a few questions, but they've been touched a little bit, but I also want to open up, these are for the department, but I want to open them up to Vaughan as well, VON, sorry. In December 2021, part of our initial investments were to support those working into continuing care, including $1.3 million to attract workers to parts of the province where staffing is most challenging. Can you tell us a bit about what that means for rural areas and for the home care sector? And
I would guess that's to Mr. Demmett
Yes.
or Ms. Curley?
Yeah.
Which one of you two want it? Mr. Densmore.
You're asking specifically to the staffing levels?
Correct.
I think we're challenged everywhere right now with staffing. We have seen, through our international recruitment, we have seen an influx there to the rural areas. But I would say there is still a challenge in rural Nova Scotia to recruit and I won't say retain so much, but just to recruit into those areas. The population is getting better. I think the investments in tuition, I think the investments have drawn more people into the classroom. I think that will show eventually, but I don't think it shows today. But the promise is that it is bringing interest to the continuing care sector as a career. And, you know, it's just a matter of getting folks through the classes and into the workforce.
MLA Barkhouse.
Well, isn't that the thing, you know, something that should have been fixed years ago can't be fixed tomorrow. I wish they could. Now, our government has been working really hard for seniors and improving the sector since being elected. And I know this as an MLA, I know this as I am a constituency MLA, but I also, as we discussed earlier, did the job for 17 years. And which, you know, was passion in all actuality. What recruitment benefits, and this is for Vaughan, because earlier someone on that side asked it, but the department's answered, but you guys didn't really have a chance because you had said that you were involved in a little bit. What recruitment benefits have been seeing as a result of international recruitment into the sector, and how is retention going, and are there any positive stories you can share with us?
Mrs. Curley.
Thank you. We're really quite excited about our international recruitment efforts. We, as I mentioned, we started just before the pandemic and recruited primarily from northern parts of India and Nepal. So bringing folks into the province and having their feet on the ground took us quite some time initially, but as we started, we were bringing in groups into 3 of our most pressing areas as far as the size of the wait list and the vacancy rates. So we focused our efforts in those areas, and it was I believe it was Janet maybe who mentioned earlier, there's a lot of effort that goes into orientation to get somebody not only familiar with the work that we do, and of course our internationally educated nurses were then doing a home support job, so becoming familiar with the job, with the scope of practice, but also becoming familiar with Nova Scotia and the culture and the settlement and all those sorts of things. So it was very rewarding for our management staff, because our managers need to support the front line, and what we hear from our staff is if they feel they're really well supported, they will stay longer. So we spent a lot of time preparing our management staff to prepare for international recruitment, and our supervisors and our other colleagues to support people once they began arriving. We buddied them up with other staff, which was again a really, it was rewarding and difficult all at the same time, because I think learning new cultures and learning how to support people differently was, and continues to be a bit of a challenge for us. But had we not brought those folks in, our wait lists, I firmly believe, would be far higher than they are now. So the benefits, I believe, is your question, is we have a much more diverse workforce. We have, we're able to support a diverse clientele better. We're learning. It's really helped broaden our horizons as far as our work on EDI and those sorts of things. And we're now supporting some of those staff who are interested in moving on to be nurses in the province. So that's really interesting and rewarding part of the work as well too. And I think people are seeing a progression and an ability to progress. We're seeing families come over and opportunities in community for other employment and those sorts of things. The retention on the international recruit are better than our general population of home support staff.
MLA Barkos.
Excellent. That's excellent. Thank you for letting me know. So we've talked about that. We talked a little bit about the wage increase and the post secretary support. What about, what can you tell us about the CCA practical nursing bridging program for CCAs who have worked in the public sector for at least 2 years? Because I know when I was in that line of profession, I would have only loved to have that opportunity to bridge over, because it's expensive, and it's time and energy. So if Deputy Minister could answer that, that would be fantastic.
Deputy Minister Barbrick.
Thank you, and lots of others would have something to add to this. So we're really excited about this. We want continuing care, home care specifically. We've got 90% of the population have said they want to be cared for at home. With our aging population, not just in Nova Scotia, but across the country, that is going to take a concerted effort. And we want home care to be an employer of choice. It is absolutely, it needs to grow. We need to have people see themselves with an entire career, if they want to, in continuing care, home care, with pathways for themselves for either career growth or that works with different ages and stages of their families, that they can be in choice about whether it's part-time hours they want or full-time hours, whether they'd like to progress as a CCA to an LPN to an RN. So this program is our first pilot that will take a group of CCAs specifically from continuing care and go through the training together to become LPNs. And that's a partnership we've done with Nova Scotia Community College and employers across the province that we intend to learn from and apply that more broadly in the upcoming years. We do see it as a way to grow with the person that wants to stay in the sector. I do think that VON maybe has at least one, if not maybe a couple. Seven people in that program. So if that's something that you're interested in hearing, you guys would have a different perspective maybe than I would.
Emily Barkos, do you want to hear from the Victorian Order of Nurses?
Yes, I really would, actually.
I assume Ms. Curley?
Yeah, we were really excited to see all of the bridging programs enhanced over the last couple of years. So when we put the expression of interest out to see who would be interested in bridging from CCA to LPN, we had a tremendous amount of interest. And it's typically being able to, how do we support, what's the number of people we can support through the program, and try to contain it, because we often have so much interest. And of course, it was a limited number of people this year, and we were really grateful to be able to support 7 people going through that program. We have LPNs bridging to RNs as well too, and every year we see those numbers increasing, and there's lots of opportunity for them to go back to school, get funding support, and come back often and work for VON again, which we are very grateful for.
MLA Barkhouse with about 10 minutes.
But thank you. I appreciate all your responses, and I know that, again, you know, we're moving along. We inherited quite a bit, and so I'm glad to hear that information. I will pass it on to MLA White for his questions.
MLA White.
There's 4 of us.
Thank you, Chair. I just have a couple of quick questions. They won't be long. I apologize, folks. Really, I think they're directed at department. It may be VON, but more department. But we're talking about retention earlier. You folks were talking about retention. So you think about the physical demanding aspects of home care work. What are we actually doing to make the workplace safe?
Who you want that to, MLA White?
Departments.
Okay. Deputy Minister Barbrick.
We can start with me. Certainly, Janet, as a member of the WCB board, as well as in your role, and has been involved in safety initiatives and leadership and safety initiatives for a long time, can't go without saying. But I will.
Do you want me to start with Ms. Hales on that? While you're looking.
Do you want to start? I know I have a nice little list of stuff here somewhere. Let me just run through. Okay, here's a little cheat sheet that might help. I'll start, and then Janet, if there's things to add there. So in the last couple of years, we've probably invested about $6.5 million in safety initiatives across the continuing care sector. We have bought a ton of equipment, because one of the risks to people working in homes is that if there's not proper lift equipment, then people are unsafe practices and find themselves injured. So there's been about $2 million in additional equipment, different types of lifts and slides and that sort of thing. We have put in place an employee and family assistance program that hadn't been there previously to support families when they need support. We've done and continue to do with AWARE and other partners all kinds of training around proper lifts, workplace violence, things to support people in home. We've put in place a return to work, stay at work program to support those that have a workplace injury that either want to stay on the job with modified duties or enter back into the job after they've been home with an injury. We're seeing good success there. We've created an occupational therapy, physiotherapy support team that supports the home care agencies across the province by actually going into the home with potentially a VON nurse and giving them some tips and ways to lift differently or to conduct their work differently to reduce those injuries. We're hearing great success from those, which is really a train the trainer kind of model. Of course, the behavioral support intervention investment, we've got 4 sites right now that are focused on different types of behavioral support with different types of clients that may be dementia or some other things that can display some levels of violence that people are having to learn how to work differently as dementia numbers increase and more people, by the time they're seeking care, dementia can be part of the challenge. So with all of those safety efforts, we're seeing some good signs. We're seeing our number of injuries is reducing for the first time in many years. The duration of that time off work is reducing for the first time in years, and our WCB premiums are showing a decline for the first time in years. So it seems to be that those investments are moving in the right direction. There is lots of work left to be done. I 100% agree with Nan about and Janet about the different risks that are presented to employees working in somebody's home. It's a much less consistent work environment, and we need to continue to work together with all of our partners to ensure that we reduce risks to workers every chance we get. I don't know if Janet, you want to...
Ms. Hazelton.
Yes, I agree. There's been a lot of work done. Starting, well, WCB, the highest rate of injuries in healthcare is both in long-term care and community. Acute care got a handle on it early because they had more resources. They had the ability. Their budgets aren't as constrained as many of our long-term care and community care. So they had more money to deal with it. But VON, I sit on the committee that's looking after that. So WCB basically said to their partners, you've got to get a handle on this because your rates are the highest in the province and in some places the highest in the country. So that means we're injuring a lot of people in those two sectors. So the first thing the committee did was Aware NS, who's underfunded. I'll put a little plug in for them. They only have about 4 staff, but they do a great job. They went to all of our VON sites and did an evaluation of their safety and did an audit. And then many employers wouldn't share their audit results, but VON sat with us, shared the results, and we started working on what are we going to do to fix it. Lifts, equipment, all that investment happened. The biggest risk is not knowing what you're going to see on the other side of the door, and that's really hard to mitigate. That, like I said, we've had clients where their family member was there when our nurses visited or others visited, and they were violent. And there's I don't know what the answer is to mitigate those. I think we have to give, like I said before, continuing care has to give VON more latitude to stop caring if that's what's required, because it's not that easy to just stop care. And I hate to say it, but they have to sort of seek permission, and sometimes that's not necessary. That if a nurse or another worker feel uncomfortable, they should just stop the care. And sometimes, I'm not saying VON or continuing care would say no, it's changing the culture of our nurses and others who feel that, oh, but I still need to go because that's a client, I need to change her dressing, I can't leave her. That's one of the, so our nurses will still go into houses that they haven't cleaned the snow off their steps. They're told they don't have to, but they still do it. So we're working hard to change that mindset, but we all need to accept the fact that if someone says, I don't want to go there because I'm afraid, that's good enough. It stops right there. That's not, sometimes you have to justify it, and it gets difficult for people because they feel guilty. And it's not nanny's fault, it's nanny's son who's not appropriate. That's the reason why I don't want to go, but see, nanny still needs care. So we have to change how we think. And healthcare workers, we have rights too, and oftentimes the rights of the patients and clients trumps ours, and that has to stop. Blame the victim. I mean, lots of our violent situations, nurses and others are asked, so what could you have done to prevent that? What? So we're working hard to change it, but we have to change managers. We have to change everybody in the system. That there's nothing I could have done to prevent it. And don't ask me that because it's insulting. But we're still, last week, that was the response of one of our managers, not in VON, but still, we had, and it was like, now let's talk about how you could have prevented being kicked. Huh? I don't think we ask police officers that. So I think we have to start to think about the rights of workers are the same or more than the rights of residents and clients. It's not okay. And I've been preaching this song for a long time, but VON have done a lot of really, really good work on increasing the risk to the workers. But you can never, ever get rid of that risk unless we send 2 people in.
Thank you. MLA White with 2 minutes left.
Thank you. Thank you, Ms. Hazelton. I'm glad you had an opportunity to answer that. I appreciate that. I'm thinking of some of the VONs I know at home, and they will do exactly that. I have some good friends who are VONs, and I'll tell you, they will do exactly that. They're going in there one way or the other, so I appreciate it. But I guess my next question, if there's time, would be back to the department, and I'm going to ask you about the CAPABLE program. When is it operational? If you can tell us a little bit about it, what it is. Thank you.
Deputy Minister Barbrick with about a minute and 20 seconds.
Thank you. I can make it quick. We're really excited about it. VON is our partner in it, as it turns out. We did an expression of interest. VON was the successful partner, so it's a program that comes out of the Johns Hopkins Nursing School. It is essentially an occupational therapist, a registered nurse, and a handy person through a process of working with a family, identifies the goals of the family member, and through some adjustments to the home and some supports around a care plan and where people hope to get to for themselves through a series of kind of coaching support sessions, up to 6 per family or per household. The intent is to support people to live in their home longer. So there will be 3 teams, 300 homes. Will be a pilot program that we are about to get into here this coming winter and see how that works with the idea of supporting people home longer. So very excited. Nova Scotia will be the first province in the country to implement that program, and we hope to learn a lot from the first pilot and then upscale it in the upcoming years.
MLA White with 15 seconds.
I never met a nurse that wasn't compassionate.
Thank you, MLA White. Okay, so for the next round, it'll be 7 minutes each. So we'll start with the Liberals. MLA Regan.
So quickly then, Deputy Barbrick, I did hear about Aliyah Care and getting the workers to actually enter that data. I heard some hesitancy there, and I know, for example, when the UK brought in one person, one record, it didn't end up working, and they removed it because they didn't have people. There wasn't buy-in. So I'm just wondering what you're doing to ensure that there is, in fact, buy-in to make sure that people who haven't used this kind of a system before do that.
Deputy Minister Barbrick.
Thanks. For those organizations that have migrated to Aliyah Care, they already had some other form of product in place that they were using. So they were a little bit ahead of the game in that they were using some digital tools already. Inter-I, I would say, is further, so that's the tool being used in long-term care facility that really enters all the specific care plan data about each resident so that we can both learn from that over the upcoming years, and it starts to identify a much more customized care plan and staff plan for facilities based on what we learn. But that is a Canadian Institute of Health Information direction, so that's a national organization that really has been promoting Inter-I for a number of last few years. So Nova Scotia has now implemented, and what we knew, and I'm going somewhere with this, I promise. What we knew in year 1 was that it was kind of not going to be reliable data. Everybody's learning. They've never used it before. They're training. They've got some train the trainers on the floor. Everybody's learning a new tool. They're moving from paper-based charting to digital charting. And we know that that takes time to improve the quality of the data. So Aliyah Care will be exactly the same. You start out with an introduction orientation with supporting kind of consultants out there, teaching people how to learn them. To learn them, you get a few people that show themselves to be kind of data friendly. They start to lean in on the tool and become sort of super users to teach others, and over time it gets better and better, and that tool really starts to get maximized at a year, kind of in, a year and a half in. So anytime you're migrating to a new digital tool, we've got a whole workforce to take along on that journey, so we know it'll get better with time.
Thank you. MLA Regan.
So I just want to point that out because, in fact, in the UK, when they brought in one person, one record, it was at a cost of $4 billion. To take it out was multiples of that. So I just want to sort of flag that as a potential issue, and I can see that you're on it. My other question, and then I'm going to pass it over to my colleague, is about palliative care, because according to the Ontario Auditor General, there should be 7 hospice beds per 100,000 people. Now, we started moving in that direction when we were in government, but I'm just wondering, how is Nova Scotia doing in providing over 70 hospice beds here in the province?
Deputy Minister Barwick, I'm guessing.
I am so sorry, but hospice beds don't fit under our portfolio. So it's DHW that actually owns those hospice beds and the contracts with the hospice organization. So I don't have the latest on that.
All right, didn't realize that. I'm going to pass it over to my colleague.
That's okay, I didn't acknowledge her yet, but that's okay, I like her. MLA Di Costanza.
Thank you, Mr. Chair.
Oh, with about 6 minutes left.
Oh,
I think, hold it. No,
No,
3.
no, that's why I have
Sitting there
to.
going, it's like, sorry.
I know I had 2 questions and I had to choose between the 2. So I'm going to ask this one. In the meantime, we know that we have inflation, and right now, as the caregiver benefit to provide home care within family members is $400. Is the government looking at increasing? We know 400 is really doesn't go very far nowadays at all. If you divided that by minimum $25 an hour, that doesn't give you too many hours. So is the government looking at that 400 and increasing it anytime soon?
Deputy Minister Barwick.
Thanks. All I can really offer is that we're regularly looking at opportunities to improve access to various programs. So I don't have anything specific I can share with you on that, but we are regularly looking at ways to support Nova Scotians.
Emily Di Costanzo, 2 minutes left.
All right, that gives me time to ask the other one.
There you go.
On the senior care grant, how did you arrive at the amount, and how did you decide who can qualify, and do you think it goes far enough?
Deputy Minister Barwick.
Thanks. Thanks for the question. Seniors Care Grant, I think we've now supported about 85,000 people with the Seniors Care Grant over the last couple of years. So we originally started at $500 a year. We've increased that to $750, and we increased in the second year the number of things that are eligible for it. So we expanded it into things like, massage, physio, various kind of health care supports that maybe aren't part of a person's own ability to cover those things. So we really have expanded it from basic kind of home support things, lawn care, snow removal, anything that you might want to use it for, and then added in some additional health services. So the utilization rate has gotten better every year. We launched this year's program in September with an additional, it went from 500 to 750. We've got, I think, about 20,000 applications in now. Anybody that has been the recipient, I have lots of elderly people that I apply for on behalf of in my family. So it's my email and address attached to it. So anyone that has received it another year automatically got an email letting them know that they're eligible for it again. It's very easy to apply for. It was a series of about 5 questions. We've built in a feature this year with Canada Revenue Agency that it automatically verifies your eligibility against that line 146 in your income tax. So it used to be that the risk would be if the person applied and then it was verified after the fact, it might have to be recovered, but now that's been smoothed out, so it's gotten easier for people. It really is 4 clicks on a computer. I know not everybody uses a computer.
Thank you. Sorry. MLA Burrow.
Thanks. Well, I'd just like to continue with the sentence you were in the middle of.
Thank you, MLA Burrow. Deputy Minister Barwick.
Thanks.
Yep.
Is that okay?
I sent it off to you.
So, thank you. So for those that do not either use a computer or their family member doesn't do it on their behalf, there's a short application form that can be picked up in lots of different locations and submitted by mail.
MLA Burrow is always a gentleman.
And yet it remains the case that our seniors care grant is distinguished from the seniors income benefits available throughout almost all the rest of the country, in that it is available only for certain specific things, is not a general income top-up as is generally available. And it's also true that although it does cover many of the things you spoke about, there are many seniors' health-related things, glasses, dentures, hearing aids, and so on, medications, that it's not available for, and this isn't the case for parallel programs outside of the country. So being clear about that, I want to ask Janet and Nan, when we think about the clients who your members serve and the pressures of the cost of living that your members experience them as being under, from your point of view, would a senior's income top-up, as is available elsewhere in Canada, not specific to certain things, but simply if you get the supplement, you get this much more, is this the kind of thing that would recommend itself from your experience?
So, Mr. Burrell, I assume that's to Nan?
That's for Nan and Janet.
Nan and Janet. So, Nan first.
Thank you. I would think that the more barriers that are constructed to access support for seniors is a negative thing. I just think that a lot of our seniors do live in poverty. I did care for a lot of seniors in long-term care, many of them farmers, only having access to OAS. So I think that any supports that are available, the easier they are to access and the fewer barriers that exist, the better our senior population will experience that support.
Ms. Hazelton.
I agree with Nan, and I think it's important that we look to some of the things that are covered, like dentures, because people are going into their homes, people have lost their dentures or broken their glasses, and glasses and dentures are expensive, and people need them. And so it's not unheard of that some of our workers will help or bring something or bring them food, or so that happens more than we think, because they know how empty their fridges are. And so and often they may not have someone to help them, and that's difficult. The job is difficult on a good day, but seeing those kinds of realities makes it even more difficult.
MLA Burrows with about 3 minutes.
Thank you. I wanted to go back, Ms. Curley, just for a minute to, you were speaking about wait lists earlier. And some of the improvements that have been made around wait lists, but I'm wondering about when we think about not the nursing side, but the home care side. Where are we now on the average waiting time to receive care for the people who are on the list? So I'm not thinking so much about the expanse of the list, but for those who are on the list, what changes are we seeing, or are we seeing them, and what is the average wait time for people?
And that's to Mrs. Gurley. Mrs. Gurley.
Do you want to?
No, you go ahead. I'll join in if there's anything.
Sure. I'll just speak to the process that we follow, and you might have, Tracy might have more statistics that could be helpful to answer that question. For how we manage the wait list are those who are coming out of hospital have very short wait times. We usually try to get those folks services right away, if not maybe a day or two delay at best. We have a priority categories that we get from the care coordinators, the hospital-based care coordinators, and we place folks on those lists based on those priority statuses, and those with the highest need and highest priority get services very, very soon. So we find our very complex people maybe have, just a few days wait, but those with very low needs and lower services, it's months. But I'll pass that on to Tracy to. Yeah.
Deputy Minister Barwick.
Thanks. Just to add some numbers to that, we have about 900 people on a wait list for home support right now, not home nursing. To Carol's point, about half of those people would be getting some hours of care, but not the full hours that have been directed for them. and many of those would be receiving direct benefits while they wait to get full hours of care. So certainly lots of creative things out there, and VON, not to speak for you, but nursing clinics we've been expanding so that anybody that, in fact, I have an aunt and uncle. I have an uncle with a deep wound right now, and they are going to one of VON's nursing clinics because my aunt drives. And rather than have VON come to the house, they actually don't mind the outing. A few times a week they go and get their care there, so that's reduced the time. There's also a bit of virtual care that we're piloting around that's more education-based or follow-up, so if it's not hands-on care required, but kind of a check-in. So there's some things happening in that space right now. The other thing that we are working with right now is Shannex is delivering some home care in Shannex assisted living facilities with some of their nursing capacities that we're trying on a very small scale just to see if there's things that make sense. If somebody's already in their home, to provide them some other support.
Order. Thank you. Next will be MLA Young.
Thank you, Chair. A question to DM Berber through the Chair. In your opening remarks, you spoke about the core program. One of the places will be opening up will be in Shelburne, and I had an opportunity actually to go over and see some of the exciting stuff within the core program, but I wonder if you could touch on it just briefly for some of the members who might not be familiar.
Deputy Minister Barber.
Sure. So CORA is a partnership with Nova Scotia Community College that we piloted first in Middleton 2 years ago. And COVID, of course, caused a little bit of a rough start there, and happy to say that we've now, built the skills and can manage that. But we've now launched 2 more locations, Port Hawkesbury and Shelburne, and they are in NSCC locations, so they actually have programming. They have some of the students in the building provide kind of supports and program. It's really designed for people over 55 that live in community and are looking for opportunities for physical activity, new skills, new learnings, as well as kind of exercise classes, everything from, I think some of them have cosmetology students actually come down and do nail care 1 day a week. And I think we've just recently gotten the numbers that last week there was something like, I'm going to get this wrong and Kim's going to roll her eyes behind me, but I think something like last week there was almost 1,000 things ran last week across those 3 locations. And what it's showing is that it's community connection for people. And when they come out, because there's a full-time person that is a coordinator in the program, and they're actually making connections for that person to other resources in their community. So it's intended to create community connection, physical activity, cognitive challenge, all that stuff that's really good for all of us, as well as make connections to other people and other services. So we've got 3 now in place. We had a chance to test and try 1. We've added 2 more, and it is our intention that we will continue to scale that in the upcoming years.
MLA Young.
Perfect. Thank you so much, Deputy Minister. And I'll pass it off to my colleague, MLA Palmer.
MLA Palmer.
Well, thank you. First, I just want to thank all those who work in the home care sector and in community. And I don't think there's any one of us around the table that hasn't had a caring, compassionate worker in the home of all of our families at some point. I know I have, and just want to give a big shout out to all those, like we've been talking about, the conditions they go into. They do an amazing job. I also I'm taking a lot of notes here today, and just a few comments have hit me, like I think it was mentioned better conditions of work lead to better conditions of care, and I think I'm quite optimistic by the conversation today that I think there's good communication and conversations happening with workplace safety and different things that I think can be positive going forward. Just wanted to make those opening comments before I ask a couple questions about maybe some community kind of program that is happening right now. And I'll ask this question to Deputy Barbrick. Can you tell us a bit more about the Age-Friendly Communities grants programs and speak to any approved projects and their scope that have been happening?
Deputy Minister Barbrick with 3.5 minutes.
Thanks. I'm going to just actually refer to some materials to make sure that I don't make stuff up and get myself in trouble.
I do it all the time.
So this initiative started several years ago now. It really is intended for nonprofit, grassroots, community-based organizations to have the chance to make application and be considered for things that work in their own community that are customized to their own community. So they can be eligible for up to $25,000. And the applications are actually open now. So for those of you that have community groups in your constituency that you deal with, please encourage them to go on and take a look. But there's some really exciting things. So they focus much in the space of CORA, or what we'd call kind of early intervention in community, not typically at the point where somebody needs care or nursing support, but rather more focused around things like physical activity, combating social isolation, improving digital literacy. So last year's applications, there was 37 awarded to almost $500,000 was the total. But the type of projects are really exciting in terms of keeping people well in community, and that's the focus of that. So just even as a couple of highlights, Dance Nova Scotia did specific programming for seniors that have never been involved in a dance program before. We had the, just randomly sort of choosing one, Meat Cove Development. So Meat Cove did a project where they promoted storytelling in their community for their elder generations that some of the younger folks, that couldn't imagine life in Meat Cove 70 years ago. So they promoted and they videotaped those and made them part of a digital library. It's North Shore Senior Citizens Association, $10,000 on emergency preparedness in the home. So they really did work with some of their seniors in community to make sure people knew what it was to be prepared for emergencies. South Shore District Pipes and Drums. They ran a specific seniors program to learn to bagpipe. So there's, 50 projects that really are local, grassroots, kind of grabbing on to the leadership in people's community that's unique to their own community. So again, if you have people in your community that might want to consider those kind of things, the applications are open now.
Emily Palmer with less than a minute.
So, there's so many other programs like the Adult Day program and the Enhanced Care Adult Day program. There's a lot of great things happening, and I'd love to hear some feedback about that. But it was mentioned earlier just about the concerns that people in the home care field have who are working in the community around cell coverage. But just as a reminder that our government just recently announced a $47 million investment in cell coverage in an infrastructure around this province. So I think that's a very positive step for those in emergency services and in home care people and who are working in the community. So again, thank you for all you've done, and the information's been great, and I think we have a lot to look forward to optimistically. Thank you.
So no question. Okay. So with 3 seconds, what we'll do is do closing, which I'll go right to left. Shouldn't be longer than 2 minutes-ish. So I will let Nan McFadden go first.
You got 30 seconds.
I could have taken out of her opening, but...
Thanks. We really do appreciate the invitation to speak. I do find it kind of bizarre that we're talking about things that don't involve secure hours for employment for members. That some of the questions asked were strange to me. Also, glad to hear about the cell service announcement, because we drop calls on Mount Tom, and that is not crazy rural, so good luck to us with that. But I would leave you with this. We have workers that are not getting enough hours to live in home support, and that none of you asked any questions about that is not hopeful for our members who will be watching this. So you've left them with not a lot of hope, and that kind of sucks. But thank you.
Ms. Hazelton.
Thanks for the opportunity. I think it's high time that we focus on community care, because it's a very valuable service. We don't have rooms in our hospitals. Some of the positives, though, the clinics are a good thing. We need more of them, because many of our ambulatory care units in our hospitals just can't accommodate because they're too busy with overflow patients that are supposed to be admitted, and that's where they're going. So I think we need a lot more clinics. Like I said before, we need our nurses in VON to have a lot more autonomy to make independent decisions without having to get approval from continuing care. That's a barrier that needs to go away, because believe me, the nurses I represent do not want to go back and visit if they don't have to go back and visit. But if they have to wait for approval. That has to go away. And I would say, thirdly, strong consideration has to be given to hiring nurse practitioners in the community, because people can't access if they don't have a primary care physician or nurse practitioner. They can't get in to receive the care. So if we have one on staff, that would help get people, they'd be able to admit to the service and write orders and make sure that these people stay in the community and don't go to our emerge departments when it could be easily solved in their homes.
Thank you. Deputy Minister Barbrick.
Thank you for...
She's going to say yes to all this.
I'm going to say thank you for having us here today. I would say, the investment and focus on the continuing care sector in the last 2 years has been unparalleled. We have come a long way and have a distance to go, and there isn't anything here that was said today that I don't agree with. So I think the positive news is we are all on the same page around the needs to serve seniors in community, and we'll keep on keeping on to do that better every day. Thank you for having us.
Thank you. And Mrs. Curley.
Thank you to the committee and to the witnesses to be part of this conversation today. It was really very thoughtful questions and very thought-provoking conversation. As we all understand, home and community care is complex and it's unique in nature. Our work has been difficult but extremely rewarding. And we, I know Jeff and I both have felt over the last couple of years there is a real shift happening in the understanding and the focus and the attention for home and community care. And we really appreciate that. That's demonstrated by the many investments that have been made and the really strong partnerships that have been built over the last few years. We're grateful to have the opportunity to be an active partner with the many projects and initiatives. It's been a very exciting time. We agree with the nurse practitioner comments Janet has made. We're really excited to be participating with a first cohort in the province of community nurses for RN prescribing, and we're really looking forward to that. There's a lot of exciting things happening. We're happy to be part of that, and we're really looking forward to the ongoing work. Thank you.
Mr. Densmore, anything?
Nothing from me, no, thank you.
Okay, I'd like to thank you all for coming. It's been eye-opener, I'm sure. We're going to take a 3-minute exactly break before we come back to deal with some committee business. So we're in recess. Order. Okay, so we're going to deal with some community business first, and then I know that MLA Regan has another motion. So the first issue is going to be March 2024 meeting. Obviously, it's scheduled for March break, which we're not going to do. So the chair would prefer after March break because he's actually not here the week before. So I don't know whether everybody else is agreed. No critique from Grampy Palmer. So I'm wondering, is the rest of them okay? So if we do after, we have two options. We can do it Tuesday, March 19th. It would be in the morning at 10 a.m. Because there's a committee in the afternoon. However, obviously, if the House is sitting, it'll be at 9 a.m. Right? So we have no idea when the House is sitting. The alternative to that, I think, was the 21st, which is a Thursday afternoon or morning, depending on if the House is sitting. So what's the will or wish? Does anybody have a preference? Okay, 19th at 10 a.m., 9 if the House is sitting?
Keep it to a Tuesday.
I'm not, it seems like everybody's in agreement, so all in agreement. This one will be real quick. January 9th meeting will be agenda setting. So please send, have your caucuses send things to the clerk.
So you want them sent now?
Oh, agree?
In December, after the next meeting.
Okay.
Right after the next meeting.
Whatever the clerk says. So the last thing, we had a motion sitting on the table from last, which is attached in your document. So the motion that was moved by MLA Regan and then amended by MLA Palmer. So, oh, you want me to read this loud for Hansard? I hear. Okay, no problem. I said whatever the clerk says. So the motion as written is, and this is from MLA Regan, I move to share right on behalf of the committee to the Minister of Health and Wellness, to the acting CEO of the Nova Scotia Health Authority and the CEO of IWK Health Centre to let them know what we heard today about the need for Mi'kma'ki represented in higher levels of the health system and encourage them as a starting point to each of their health authorities to appoint a Mi'kma'ki advisor to the executive team of those health systems. And obviously that was moved by MLA Regan. MLA Palmer, I'd like to make a little amendment to this if I could. What I'd like to propose is to request a letter from the Department of Health and Wellness asking for an update on their hiring practices of what we discussed today, highlighting what we heard, but asking for an update from what they're already doing on this. Again, this was moved by MLA Palmer. This was taken out of Hansard to try and get the motion, and MLA Regan will give me a wink when she goes, this is why I love them in writing. I know she'd laugh at that. So we're dealing with the amendment. Does the member agree that is what your amendment was?
Yes.
Okay. So MLA Regan.
So I'm just not clear. Do you want that in addition to what we said, or, because it sounds like it's not a little amendment, it's a big amendment. It is completely changing what we asked for in the original motion.
So, MLA Palmer, I'm going to ask you to comment on that because it's your amendment, not mine. MLA Palmer.
No, thank you. Obviously, we heard from witnesses at that last meeting who had concerns, and the government wants to take very seriously some of the issues that were brought forward in the Mi'kmaq community. So the difference between the motions was, I believe, we're not as a committee dictating to Health and Wellness to take any action steps around how they do their business. What I was suggesting as a committee, because they might be already doing things in regards to some of the concerns that the witnesses brought forward that day. So my amendment, my motion basically was, okay, we understand the concerns, we hear them here at the table, that my motion basically speaks to them addressing, because maybe they're already doing things in regards to some of those, and we weren't looking for clarification from the department to send us any of the action items that maybe already be taking place. That's my amendment.
Okay, MLA Regan.
So what we heard at committee was that while there are people being embedded in departments at lower levels, there's no one at the executive level. And that was the reason for my particular motion was, in fact, that this is not at the executive level. They don't have advisors at that level. And it's something that we actually did at DCS when I was there, embedding an African Nova Scotian advisor right with the executive team. So that was always at the forefront of what we were doing. So that was the reason why I didn't want to praise, an update on what they're doing, because we knew from what we heard at committee, they're not doing it. So we already had the update at committee. We know they're not doing it. That's why I asked them to take a further step beyond that.
Okay. Any other discussion? Emily Young?
Yeah, just with respect to Emily Palmer's amendment, that would make sense, though, to have to send out to the department to find out exactly what they're doing for information and to see what steps they are doing, right? So, I'll support this amendment.
Okay, I'm going to allow Emily Burrell first to speak on this. Emily Burrell.
Point of order, Mr. Chair. I'd ask you to make a ruling on whether or not the amendment is in fact in order. An amendment which contravenes the intention of the original motion is not in order.
I believe last month when we were here, that question was asked, and when I asked Ledge Council, they didn't see an issue. Now, I don't know if it was you or not.
No,
it was Gord. So if Ledge Council is already, then your order is actually, in my view, out of order because it's already been answered. If she'll check answer it unless somebody else remembers, but I think I asked a question. So I'll let MLA Regan speak while they check. Is that okay, MLA Burrow?
Is it okay if you let Ms.
Well, they check to see if it was ruled already. MLA Regan.
Certainly is.
Yeah, thank you.
So I would just say that I have no objection to us asking them what they are already doing, but I think it is important to highlight for them that there is nobody at the executive level giving them this kind of advice as executive teams are making, and we heard that from the witnesses. It's like asking them for an update on what you're doing is great, but we heard that they don't have this key thing that we heard from our witnesses is important.
So just 1 second. So Emily Burrell, just so you know, the clerk did check and that question was asked and answered. So I'm just going to call you. It's already been, they've already said it's in order, so we'll leave it at that. Sorry. Emily Barkos.
Thank you, Chair. So asking for an update on hiring practices and what we discussed today. So that would have meant that day. So we discussed it, right? Highlighting what we heard, but asking for an update on what. So this is basically, in my view, and correct me if I'm wrong, is saying we discussed it that day. You understand the issue. What's going on now? I will support this amendment because it's not. It is getting to the bottom of it. I think we can move from there.
Any discussion, or do you just want to vote? Emily Palmer.
Call for the vote.
I would just say, Chair, that no one's suggesting we don't recognize what we heard in a correspondence from the Chair to the Health and Wellness. We're not suggesting that, but I think it's been said, so
Okay.
everything vote.
Yeah.
So we're going to vote on the amendment. All in favor of the amendment, vote aye. Aye. Contrary? The amendment has carried. Now we're going to vote on the amended motion.
Can we agree on the wording of the amended motion?
Oh, really? So he agreed that's what that was. So the way I read this would be at the point of MLA Regan's representing higher levels of the, and that's where we're asking for an update. In other words, instead of and encourage them as appointing, that's the way I see those going together, because that's the change when I merge them, that's the way I would read it. So I think, Emily Regan, I'm looking at you, that's kind of what.
Today about the need to appoint.
Right,
Yeah.
and
Yeah.
at that point, that's what's coming off and adding his
And
into it.
encourage them to appoint. Like that, we're not saying you have to do it, we're encouraging them. That's
Well,
all.
what I mean is that his amendment is to basically ask for an update on the hiring practices. His amendment actually takes that out and says that's what he's asking for. Your first portion is there, his second is as opposed to encourage. That's the way I read it. I'm trying to do it quickly within 10 seconds because.
And I do have another motion.
Okay, so hit me quick because.
It's a long.
Oh, on the just a sec. On the amended motion, I got to vote once more.
So the amended motion
The amendment's carried, we just ran out of time. So, order. So on the next meeting, the first thing will be to deal with the amendment, which probably isn't bad because we'll be able to wordsmith it so people see what it is. So the next meeting is Tuesday, December 12th, 1 to 3 p.m. TR closers and doctor recruitment and witnesses from Nova Scotia Health, Doctors Nova Scotia, and the Department of Health and Wellness. We're adjourned.
Thanks, everybody.
Thanks.